Hello everybody, my name is Arsyi Fairuz Andrian, and today my friend Kiflan Dzaki Ghifari and I will be presenting about speech delay. Without further ado, I will begin. What is speech delay? Speech delay is a general term referring to the process of speech and language delays that are not in accordance with the child's developmental age. Children with speech delay have difficulty communicating effectively and may have trouble understanding or producing speech sounds, using words, and forming sentences. Some parents consider speech delay as a normal condition or something that is commonly experienced in the process of child development. Even though it's too late to talk if left unchecked and not treated with expert referrals, it can be a serious disturbance in children. Lack of understanding and serious attention from parents regarding the condition of speech delay in children can interfere with the child's development process at a later stage. Parents need to detect it as early as possible at the age of 12 to 13 months, and at that age, at least the child says one or two additional words beside mama or dada. Type of speech delay. Speech delay is divided into two clusters. 1. Functional speech delay disorder. This disorder is relatively mild and occurs due to a lack of stimulation or wrong parenting. 2. Non-functional speech delay disorder. This disorder is a result of a receptive language disorder, such as autism or ADHD, attention deficit hyperactivity disorder, that children experience. There are several types of speech delay, including expressive language delay. This is when a child has difficulty expressing themselves through language, such as using words and forming sentences. Receptive language delay. This is when a child has difficulty understanding language, such as following direction, answering questions, or comprehending spoken words. Speech sound disorder. This is when a child has difficulty producing speech sounds, such as stuttering or mispronouncing certain sounds. Aprasia of speech. This is a motor speech disorder in which a child has difficulty planning and coordinating the movement necessary for speech production. Mixed receptive expressive language disorder. This is when a child has both expressive and receptive language difficulty. It is important to note that speech delay can vary in severity and can be caused by a combination of factors. What are the causes? Speech delay can be caused by a variety of factors, including developmental disorder such as autism spectrum disorder, genetics factors, hearing loss, physical impairments, or environmental factors such as a lack of exposure to language or a speech-rich environment. Speech delay can have significant impact on a child's social and academic development, and it is important to identify and address it as early as possible. Early intervention, such as speech therapy or other specialized treatment, can help children improve their communication skill and catch up with their peers. Speech delay in children is a disorder that needs attention. This is not a diagnosis but a symptom. So in children with speech delay, it is an early symptom of several kinds of disorder. How does speech delay occurs? The cause of speech delay in children are complex and multifactorial. The factors that cause children to experience speech delay include watching too much television, minimal interaction with parents, developmental delays, hearing impairment, speech organ disorders, genetics, environmental factors, autism spectrum disorder, and blockages in the brain and nerves. Some of these factors are related to a child's environment, such as exposure to language-rich environments and interaction with parents. Others are related to medical condition or developmental delays, such as hearing impairment and neurological disorder. It is important to identify the cause of speech delay to ensure that the child receives appropriate treatment and support. If the parents suspect their child is experiencing speech delay, they should seek advice from a pediatrician or speech therapist. For the next part, my partner, Kiflan Dzaki Ghifari, will take over and explain the rest of speech delay. Thank you.
Hello everyone, I am Kiflan Ghifari and I'll continue the topic of the presentation that was explained by my colleague, Arsyi, from this slide to the end. The impact of speech delays. Speech delay can lead to various difficulties that can negatively impact a child's social, academic, and emotional development. Children with speech delay may have difficulty communicating their thoughts and emotions, which can lead to frustration and social withdrawal. They may struggle to make friends and form relationships with their peers, which can impact their social development. Research has shown that children with speech delay are at risk of experiencing a range of negative outcomes. For example, a study published in the Journal of Speech, Language, and Hearing Research found that preschoolers with speech sound disorders had significantly lower social skills than their peers, including difficulty making friends and forming relationships. Another study published in the Journal of Child Psychology and Psychiatry found that children with speech and language difficulties were at increased risk of developing behavioral and emotional problems such as anxiety and depression. Overall, the research suggests that speech delay can have significant and long-lasting impacts on a child's development, emphasizing the importance of early intervention and support. Treatments and interventions. Speech delay can be effectively treated through a variety of interventions. The most common treatment for speech delay is speech-language therapy, which is provided by a licensed speech-language pathologist. Here are some types of treatment for speech delay. Number 1. Speech therapy. A speech-language pathologist works with the child to identify areas of speech and language difficulty and develop a customized treatment plan. Treatment may include activities to improve expressive language, receptive language, speech sound production, and social communication skills. Number 2. Parent and caregiver education. Parents and caregivers can play an important role in supporting their child's speech development. Speech-language pathologists can provide education and training on how to support language development at home, including strategies for encouraging communication and language skills. Number 3. Augmentative and Alternative Communication, or AAC. For some children with severe speech delays, an AAC system such as sign language, picture exchange communication systems, or PACS, or electronic devices may be used to support communication. Number 4. Medical interventions. In some cases, medical interventions such as hearing aids or surgery may be necessary to treat underlying medical conditions that are impacting speech development. Number 5. Early intervention programs. Early intervention programs provide services to children from birth to age 3 who are at risk for or experiencing developmental delays. These programs offer support to families and provide therapies to help children catch up in their development. It is important to note that the specific treatment plan for speech delay will depend on the individual child's needs and the underlying causes of their speech difficulties. In conclusion, speech delay is a common condition that can impact a child's ability to communicate effectively. The causes of speech delay can be complex and multifactorial, and can vary in severity. Early identification of intervention is key to improving outcomes for children with speech and language difficulties. Speech language therapy is the most common treatment for speech delay and may be accompanied by parent or caregiver education, AAC, medical interventions, or early intervention programs. It is important to work with a licensed healthcare professional, such as a speech-language pathologist, to develop a customized treatment plan that addresses the individual child's needs. By providing support and interventions to children with speech delay, we can help them overcome their communication difficulties, improve their social and academic outcomes, and enhance their overall quality of life. That's all from our group. Thank you for your attention.